In my clinical practice, whether that's in sports medicine, strength and conditioning, anywhere in between, there are 7 fundamental movement patterns that define all movement that we do. The goal of today is to, 1, understand the mechanics of each one of these, what's being involved, how's it being used, and more importantly for us here is, how can we prescribe our movements on the megaformer, or what cues do we have to give to somebody who is maybe not moving as well in these movement patterns? Or how do we advance and progress and optimize someone who's already moving really well in all these movement patterns? Those 7 patterns can happen in any one or combination of these 3 planes.
Planes of motion of the body. There are 3 different planes of movement. So I've made an easy way to understand the planes of movement.
As we go through each movement pattern, we're going to talk about what plane these movements happen in, but more importantly, which plane do we usually see injury? In each section for every movement pattern we're going to follow these 5 fundamental areas here. The anatomy. What's involved? We're going to look at the mechanics, meaning how do they move and operate together. The assessment side, that's more under like differential diagnosis and clinical reasoning of injury and how we figure out what's injured. We'll look at pathology, we'll see what all the current research says about injuries and those movement patterns and what we can do about it. And then the prescriptions, what types of movements can we say to them to fix whatever injury we've defined.
How to avoid gripping and tight muscles in your workout and programming. Also how to avoid pinching at joints in the body. Front support. It's important to consider the angles of the supportive joints. For example, try to extend the angle of the wrists on the handlebars, the carriage, or the platforms by rolling the knuckles away from the wrist joint. Line the thumbs up so they are perpendicular to the forearms for support.
Put them in an isometric in that movement pattern. So if I'm just here and I'm holding here against resistance against load, I'm still working, but I'm not hurting myself. And as that gets better, maybe put them in isometric at a deeper part of the range and start to work their way through. There has to be mobility and stability.
When the spine and the pelvis are stabilizing in a neutral position, your core muscles are contracting, such as holding a plank position or a tabletop. Think of your core as a powerhouse. Diaphragmatic breathing in our core stabilizing work. Diaphragm muscle.
There's a saying that we want proximal stability for distal mobility. That shoulder blade that we talked about here has to create stability along the rib cage for that ball and socket to be able to move. When we assess and we look at people, we want to look at what muscles are involved, what are the mechanics that are happening there, and then how should they be working together and what's not working. So just a quick run through real quick with what muscles are involved. Can someone name 2 muscles involved in a press movement? Remember that scapulohumeral rhythm? That scapula needs to rotate upwards 60 degrees to allow that ball and socket to go. So always address the scapula when we look at pushing movement patterns relative to joints. People that deal with anterior shoulder pain, prepare the back side of the shoulder. Anybody have any examples on how to prep the back side of the shoulder with the Mega? Anybody know the 3 layers of stability in the shoulder? Furthermore, that's where the pain is. Tight pecs that sit right on top of that area exacerbate the pain and make it a lot worse. So loosen the pecs, strengthen the backside. As humans in today's society, we need to pull more than we push. The 2 to 3 to 1 ratio is ideal. We're all very anterior dominant.
Today we're going to talk about the movement pattern for a good squat. The common mistakes in lunges. We do plenty of lunges in Lagree to work the large muscle groups of the body, burning the most calories, most afterburn. So let's start with the feet. The muscles working around the hips and the knees. And a giant single leg hamstring curl, knee extension as the carriage is going up, and knee flexion as the carriage comes in. So extension of any joint means to enlarge the angle of the joint. Flexion is the opposite, to shorten the angle of the joint.